Hello there. My name is Julie Hirschberg, the owner of Reactive Physical Therapy and Wellness, a neurologic therapy center in the LA and Torrance area. And I join you all every week to talk about what we're learning, what we're doing here. And a lot of what we do is lesser known in the neurology world, in the neuro PT and OT world, and we like to share it. And really, our mission in our clinical world is to help people with neurologic diagnoses get back the movement, the strength, the confidence, get their life back, and do it in a way that truly changes the brain. And we're going to talk about changing the brain a lot today. And probably if you've joined our videos before, you'll hear me talk a lot about the autonomic nervous system. I'm like very, very deeply interested in it for sure. I feel like it's one of those parts of the nervous system that's often overlooked. So just add that to one of my many neuro passions. We talk about it in many different disorders too. So Parkinson's disease, functional movement disorders, dystonia. And one of the other disorders that has a very heavy autonomic component is 3PD. And really, quite frankly, many disorders that include dizziness will have a strong autonomic component. And we're going to talk about why today. And I was really moved this week to talk about this because I've worked with a few clients who have had years of therapy, vestibular therapy, and have seen specialists, and no one asked about or addressed the autonomic nervous system. And I know even for me personally, early in my career, I didn't either. So that gets me fired up. I want to get the word out about the autonomic nervous system, and because it's so easy for us to test and to incorporate into treatment. So that is exactly what we're talking about today. What is the autonomic nervous system? How it's linked to vestibular disorders, especially 3PD, and a very simple way you can start training it right now. Oh, Therese, hello from Norway. Oh, that's my people. Hi, thanks for joining in. So, let's talk first about the autonomic nervous system. And by the way, this is not medical advice. I often will tell people who reach out to me, please, you need to reach out to your physician about the symptoms that you might be having. So please check in with your physician if you're experiencing some of these symptoms to get a good diagnosis and then start treating it. Okay, that was the disclaimer. Let's talk about the autonomic nervous system. The many people have heard about the autonomic nervous system with fight or flight or freeze. That's the commonly heard of. It's the part of our nervous system that has a very long history and an evolutionary origin for us to defend ourselves and be able to survive. So, but let's talk neuroanatomy. What is it? Because you have parts that are in the central nervous system and parts in the peripheral nervous system. So, in the central nervous system, there's a lot of research in this area too. I read through quite a few fMRI studies too as I was preparing for today. But we look at the amygdala, so big fear center in our brain, the hypothalamus and the HPA axis, hypothalamus pituitary axis, key brainstem nuclei, the insula. There's a lot of descending control in the brainstem coming through the nuclei in the brainstem. So we talk about the vagus and the nuclei, the different nuclei that help contribute to the control of the vagus. There's also nuclei down through our spinal cord that then kind of go out to the different areas into periphery. And there's a lot of interconnections and communications between those key areas. And then we have it in the peripheral nervous system. And I don't know if you knew this, but I'm kind of obsessed with the vagus nerve. And the vagus nerve is huge. It takes up 75% of our peripheral nervous system in one nerve. And that's because it goes everywhere, and especially to our internal organs, our cardiorespiratory system, our guts. It's a huge, huge peripheral nerve that has so much that it takes care of. I'm reading a really great book right now, My Grandmother's Hands, and it's written by a therapist, and he talks about the vagus as the soul nerve, and I really like that because it connects all of these different areas. So, in the autonomic nervous system, you have, like many people have heard, the sympathetic fight or flight response. So, you're one part of the autonomic nervous system. And then you have the parasympathetic, which is often called the rest and digest. So this is sleep, reproductive organs, recovery of all the organs, and the vagus is a big part of that in the parasympathetic. The sympathetic is that's where we get adrenaline and cortisol pumping when we're excited or we're in a state of fear. So what we like to have is a good balance. We need both of them. We'd like to have a good balance between the two. So that's the basics of the autonomic nervous system. Now let's talk about the relationship with 3PD. And first, we should say, what is 3PD or triple PD? Some people say it's persistent postural perceptual dizziness. So those are the three P's. Persistent, it's a persistent dizziness. It's often related to postural changes, and it's perceptual. That is 3PD. It fits in the category of functional neurologic disorders that we talk about a lot. It's a functional vestibular disorder. If you meet somebody that has it, they've had a chronic but non-spinning dizziness, so not your typical vertigo. They have a lot of visual and motion hypersensitivity, so watching TV, going in a really busy area, being on screens, which we all are right now. Those are very common in 3PD, and also an unsteadiness and being off balance. So this is 3PD. Let's start linking it to the autonomic nervous system. So first, we should talk a little bit about pathophysiology of 3PD that is still being understood. But one of the thoughts is that it's a maladaptation or a complication of healing from a triggered or acute event. So that might be a vestibular disorder, it might be BPPD, it might be an autonomic dysfunction, like an orthostatic dysfunction that can also make you feel really dizzy and lightheaded. So, and Therese actually says, I'm sure my blood pressure is on tour because of 3PD. Yes, so there's some intimate links there between your blood pressure control, indeed, and 3PD. And some people could actually have that as the initial trigger for 3PD. And so what happens over time is there is a shift in the nervous system to heavily weight that, we balance and we organize our world by all this sensory information coming in. We start to heavily weight the visual information to provide us control of our balance and our sense of stability. So we heavily weight that, which makes sense because we had some sort of insult that threw things off. We heavily weight that, and that becomes, because we've got neuroplasticity, that becomes kind of ingrained. And the central nervous system really kind of takes over and says, yep, let's use the visual system. And there's fMRI studies that show that the occipital lobe is overactive, the visual system is overactive, and the sensory system is underweighted. We use a lot of sensory information for our balance and our overall stability. And within the central nervous system, that gets underweighted. So it kind of favors visual stimuli over the vestibular or the proprioceptive cues that we would typically use. And therefore, we get a heightened attention, because our brain is doing this, heightened attention to motion and to visual stimuli. What occurs in addition to this, and this occurs with all vestibular disorders, there is an activation in the autonomic nervous system. And this makes a lot of sense because, of course, when we are acutely experiencing vertigo, for example, or having a big episode of feeling off balance, the first thing that our system is going to do is go into fear mode, like, let me stay balanced and let me stay steady, right? So automatically our autonomic nervous system would be activated. We often then feel some of those associated signs: nausea, vomiting, increased heart rate, sweating. I mean, I know because I've had a vestibular disorder and have felt all of those things. That's my autonomic nervous system. It's supposed to do that. It's kicking in. Now, what happens though, as we experience this and we don't start undoing that, it can become really ingrained and we have a pretty vicious cycle. And some of the fMRI studies that are starting to come out in 3PD are seeing that. They have found abnormal responses in the insula, for example, and the insula is also found in dysfunction of the autonomic nervous system. So they're finding these correlations. I have to share with you a couple of very recent articles that came out this year. There was this really lovely conference proceedings from the IEEE conference last year, and they actually hypothesized this, as we all have, the autonomic nervous system is involved, but then they went to test it with heart rate variability. And this is something that I've been monitoring more and more myself as an outcome measure to look at autonomic nervous system tone, parasympathetic tone. And basically what they found is that compared to healthy controls, people with 3PD had a lower parasympathetic tone, a lower variability. Variability is an important part of our autonomic nervous system. Lower variability of parasympathetic tone and a higher sympathetic vagal balance. All of those things that I just said, they found in their study when they measured heart rate variability in people with 3PD. So, one piece of evidence for you there. Because people have been looking at the autonomic nervous system in 3PD, they have also looked at, well, what are the effects then if we treat that? And another recent study from last year, by the way, I'll put links to these here, was they used vagal nerve stimulation. So non-invasive, it's like right here to stimulate the vagus nerve, and they did it in people with 3PD. This is something that's been used for cluster headaches and migraines. And because of this hypothesis with the autonomic nervous system, they did it in 3PD, which I find fascinating. And they also found improvement in people's symptoms with vagus nerve stimulation. So huge. I think these two studies really struck me, and I think the bottom line here is that there's a lot of overlap between the autonomic nervous system and the vestibular system. You can't really treat one without the other. And, the results of this vagus nerve stimulation study show us, well, treating the autonomic will actually help the vestibular. So I would argue, how can you go about your intervention program for 3PD without the autonomic nervous system? And I would even argue you should start there, because there is no need to push into sensitizing the nervous system to sensations that are very stimulating and fear inducing without giving the person the control through their autonomic nervous system to bring those symptoms down. So we start with that autonomic control first. And I would argue, like, let's activate that vagus nerve without having to stimulate it. Let's activate it naturally. Not that this isn't natural, but it's an external stimuli. We can activate our autonomic nervous system through many, many different ways. And as a therapist, I think it's really important to have a few tools in your toolbox, because depending on the person's past, their even a history of trauma can make people respond very differently to some of these autonomic nervous system activities. You want to be very sensitive to that and be able to have various different ways to practice. So I want to share with you one very simple one. I actually printed it out here because this is something that we share with our clients, and I have it here if you have it, if you want to download it. I'll put a link in, but this is a sitting grounding practice, and this is a activity that helps modulate the autonomic nervous system. One of the really great things that this also does for 3PD is it helps activate the sensory system, our proprioception, our somatosensation. This is the system that in 3PD, the brain has stopped paying as close attention to it, and we actually want it to weigh it. We want it to weigh it. I don't know if that makes sense, but we want the brain to listen to this information more. So this activity both tones the autonomic system and it helps the brain pay a little more attention to the sensory system. So if you download the handout, very simple practice of a sitting grounding technique. So you're sitting, you start in sitting. I like to sit in a chair with a back, and you just pay attention to the contact points with the surface. So very sensory oriented. Do you feel the floor beneath your feet, the shape and the coldness or the heat of the chair on your thighs or on your back or your hands on your lap. So you pay attention to where you are in contact with the surface, and then choose one of those areas. So I often close my eyes because I need to take my vision out so I can feel a little more. Close my eyes. I choose the strongest contact point. And often for me, that's my thighs or my back against the backrest. And then the practice is very short to start. For some people, we even just do this for 30 seconds. Just pay attention to the sensation of your body supported at that contact point. Just pay attention. As soon as I close my eyes, my brain starts to wander and I start thinking about what I'm going to eat tomorrow and what I'm doing and what I did yesterday. Many thoughts come in. That's normal and that's okay. Just keep coming back to the sensation and to that grounding, and really noticing how you are supported by the ground, by the surface. You can do it in sitting, you can do it lying down, you could do it on your side, you could do it standing, you could do it anywhere. So then we practice that for a period of time and we build up that autonomic muscle. And at the end of that, we bring it back to the body, the whole body again, and just notice, is there a difference? So typically when I do this with somebody with 3PD, or honestly with any dizziness, we work into an activity that might increase that dizziness just a tad. So maybe if I started at a level 1, I might go up to a 3, and then we'll practice an activity like this and see if we can bring it back down to a 1. Often we can, and then we go on again, and then we come back down, and then we go forward and we come back down. But that is essential in training for a vestibular disorder, and particularly 3PD, is that you have a way that you can control your symptoms, because guaranteed that you feel completely out of control with these symptoms. And if through the autonomic nervous system you can control them, then it is amazing. Now, like I said, not one tool. So I'm going to give you the sitting grounding technique. Doesn't work for everyone. There's a lot of different grounding and autonomic nervous system activities that you can do. And I highly recommend working with somebody skilled in that. So our physical therapists, our OTs, our yoga therapists, our psychologists are really, really skilled in these activities. And I appreciate them so much. So there you have it. We talked about what the autonomic nervous system is. We talked about the autonomic nervous system and 3PD. And then we gave a simple idea of how you can activate the autonomic nervous system. If you're working with somebody on your 3PD, this should absolutely be a part of it. So I highly recommend it. I'll put a link to the articles and the download for you here. And I thank you so much for joining me today as kind of go off on my soapboxes here. This is one of them that I'm really passionate about in helping people get good training. There was a question here. Yes, I'm cold sweating easily when situations get too much. That's the autonomic nervous system, and a strong need to sit or lie down. My body reacts like it's anxious. Yes, and again, this is your autonomic nervous system coming right in, and you might not even have noticed that you were anxious. It's acting before you're even aware of it. It's logic because of the sympathetic nervous system and the fatigue system. Oh gosh, and that no wonder fatigue, right? Because you have this constant on, and that's the sympathetic nervous system. It's cortisol. It's like you're running a marathon there. No wonder the fatigue, and then the lack of control of the symptoms. And you're right. She goes on to say doctors know too little about this. This is why we're spreading the word and arming people who may be experiencing these symptoms or other therapists to advocate for what people need. So thank you so much. Thank you, Therese, for joining me live too. I appreciate that. And we will catch you next week. Actually, it's going to be a special session. We're going to do it with a person that I have worked with who has had 3PD, and he's going to share his story. So that'll be a great one. Join me live next week for that.